And we are back now here on the KFYR Plus News Desk with our Medical Minute, and we welcome in Dr. McGee. Well, good afternoon and Happy New Year, Doc.
Happy New Year. How was your New Year?
It was fantastic. The holidays, Christmas was great as well. How about yourself?
Excellent. Can't complain. Bears are winning. Everything's
Bears are
great.
winning. Yeah, absolutely. We're
Yes.
excited for those Bears. We'll talk about the Bears here
Yes.
coming up in a few minutes if we can. But this week,
Yeah.
we have got early warning signs of heart attacks. Now, this is kind of the year, or the time, I should say, of the year because you've got a lot of people shoveling snow, and I'm guessing you probably have some down there in the Chicagoland area right
Absolutely.
now. But
Yeah.
what are some of the most common warning signs of a heart attack that people should watch out for?
So the most common, signs are, especially if they've gone out and they've shoveled and they're coming
Hmm.
back in and they're warming up and all of a sudden they're feeling this chest pain, right? And it's more than just a chest pain. It almost feels like a squeezing. When they're feeling that, and then they're also feeling, maybe this is radiating to their jaw, to their shoulders, to their arms, then with that, they get this shortness of breath where it feels like, they can't breathe. Those are all signs, sometimes whenever it can get to the point where they're actually feeling nausea or starting to sweat,
Hmm.
those are all signs that, something, you know, needs to get checked on. And especially if they start feeling their heart, most patients will say, it feels like my heart is beating out of my chest. And those are all symptoms. Go to the ER as soon as they can.
Do symptoms of a heart attack and a stroke are they similar at all?
So not really. So with the heart attack, it usually happens more so in the chest. With
Hmm.
the stroke, it's and if they're feeling any of these things also, with a stroke, usually it's one side of their body begins to feel like tingly, prickly, where it's just not they're smiling, but it's not moving.
Mm.
Sometimes it affects their speech where they can't speak, or they're trying to say something, but the words aren't coming out. And they start to feel one side of their body is just beginning to get very weak. Sometimes it happens really fast, sometimes it can be slow, but usually sometimes it also can be in a form of a headache. They just have this headache and it just came from out of nowhere and it's not going away. And it's really affecting them like no other headache. And say they've taken Tylenol or they've taken something, but it's just not going anywhere.
Okay.
Those are also
Um,
signs, yeah.
okay. Symptoms for heart attacks, do they differ between men and women? And if so, how do they differ?
Absolutely great questions here today, too. I love these questions because with men, we say men usually have the typical heart attack symptoms, right? That
Hmm.
we just talked about the chest, the
Yep.
shortness of breath, the vice script. Women, it's a little different. Women often are, they'll have the shortness of breath, but sometimes they get heartburn, like it's indigestion. And a
Mm.
lot of them are thinking, oh, this is just indigestion. It's just really bad today. I have this heartburn. And it's not going away. And then more than likely, women get back pain. So they'll get pain in the back area where they're, right exactly where their heart is. So they'll start getting pain back there. And then this pain can move to their shoulders, to their jaw also. But they also get more like this dizziness and faintness, but they get an anxiety also with sometimes with palpation, sometimes not, but they just feel this something's not right with my body where they're feeling something's off. And as soon if they're feeling like that, because women are just different, when these things start to happen, they need to go in right away, especially the heartburn. Heartburn is the biggest symptom for women that we see.
You know, Doc, I've talked to people who've had heart attacks in the past, and they say that, they had the big one where obviously they needed medical attention right away. But then the doctor, when they went through their medical exam, said, well, listen, you've had heart attacks in the past. And they're like, what do you mean? So there must be some symptoms, right, that are less subtle, a little less obvious signs for people that they probably ignore.
Absolutely, you're so right. And this is why, remember we talked before about going in and getting that checkup? Because if
Hmm.
you are having routine checkups, your doctor is going to do an EKG. In fact, we are so techy. I actually have an EKG on my stethoscope that I can do
Okay.
an EKG. Yep, right in the office, right for my patient. They sit down with my stethoscope and I'm going through the exam with them, and it's able to print out an EKG to let me know, is there something going on with this person's heart? And I can tell you, I've already caught 2 people that were not in good shape that we were able to get cardiac care for. So, it's so important to go in and get those routine checkups because absolutely, people can have heart attacks in their sleep and
Yeah.
not know that they've had a heart attack. And just because, like I said, they're pushing it off as, "Oh, I just really have some bad heartburn. That was just really bad pizza. It just, I worked too hard. Maybe I was, shoveling too much in the snow." And they're not thinking of their symptoms. So it can cause the micro damage in their heart where we're losing muscle tissue, and we don't want to lose muscle tissue as we get older.
Is that what they mean by a silent heart attack?
Absolutely. Yeah, yeah,
So,
because oh, go ahead. Go ahead.
no, I'm gonna let you. Yeah, I'd like to hear more about what you have to say about it.
Yeah. Oh, the silent heart attacks. So because they're getting these, like fatigue, right? Sometimes they
Hmm.
could think it's, oh, I'm just getting sick, right? Because everybody's sick. Or they'll say, I got this shortness of breath, but I really was shoveling in the snow all day yesterday. And otherwise this indigestion, like I said, the stomach, and they're thinking, well, maybe I got a stomach flu. And so we look at all these things, the cold sweat, the dizziness, maybe this feeling of anxiety, and sometimes they push it off and think, well, it wasn't really a heart attack because it wasn't, well, they said it's supposed to be this feeling in my chest and I didn't get the shortness of breath but they're not realizing that those little mini heart attacks are actually they're leading up to that silent, like you said, that
Oh.
silent big heart attack.
Hmm.
And
Hmm.
so they're like little breadcrumbs that we're trying to, they're trying to tell you, "Hey, guess what? Y Something's wrong here," and you need to get this looked at. But we often, like I said, we think that this is nothing. And how many people say, "I don't wanna go to the hospital. I don't wanna be bothered," "I'm
Right.
too busy." So, we gotta take the time for self-love this year.
Who is most at risk for heart attacks, and what lifestyle factors, I guess, increase that risk?
So, the people that are at most risk are the people that have like lifestyle, like we saw, like I love your question says what lifestyle? Well,
Hmm.
biggest ones, high blood pressure, right? Those individuals that have high blood pressure, the highest risk comes to men that are, especially after the age of 45, and especially those guys, like you said, they're retired and they're shoveling snow, and they're doing stuff and they're not really in shape. And so women after the age of 55, that's when they're at a higher risk. People who have of course men are a higher risk than women because men are more active, men are more busy. And women after menopause, that's when we start to worry about them. People who have heart problems in their family, right? My dad had a heart attack or my mother had a heart attack. Okay, so that family history puts you in that risk factor. And
Hmm.
then also, we see like with ethnicity, higher risk is observed in African American, Native American, and some Hispanic populations are more at risk for heart attack than other populations. So, unfortunately, and I would say like these risk factors are the high blood pressure, the diabetes, the pre-diabetes, those people that are pre-diabetic that are not really getting that, monitoring their diet, people with sleep apnea, people that are, the people that snore a lot in their sleep, those guys,
Yeah.
anybody that has a history of heart disease or even high cholesterol, which is something we don't know if we have high cholesterol unless we go in and get the blood work done. So those people are all considered a high risk. Smoking, of course, is considered a high risk, and an unhealthy diet. People that are not physically working out all the time and they just do that one workout when they're shoveling snow, that's
Hmm.
not good. So, and a big one is poor sleep. People don't realize how much that loss of sleep does to your body, especially your heart. Your body likes to have a regular, relaxing state. When we don't get enough sleep, we're pushing our heart to put more
Mm.
output, out. And because we're running sometimes on adrenaline, and which is not good. So, all of those things are factors.
You mentioned Native Americans. Now, Doc, I don't remember our family. Do we have any history of heart attacks in our family? Because I can't remember any, to be honest.
So, I do believe there is a history in the
There is.
family. I do believe that there is, and I do believe that those were the silent ones. Those were the
Okay.
ones that had the silent ones, and, that it was later found in their, in medical, after they went to the doctor for other reasons, that they had a
Oh,
history of these mini heart attacks, and but also stroke is in our
stroke.
is in the family.
Sure.
So,
It is,
gotta
huh?
be
Okay.
careful.
Yeah, we
Yeah.
do. Okay, if someone suspects that they're having a heart attack, what's the first? Obviously, 911 if you're alone, or
Yeah.
someone to get
Yeah.
you medical attention, right?
Yep, yep. Biggest thing is you want them to relax. Even though they're going through this, you want to set them down, stop all activity, stop shoveling, stop doing what you're doing. Just get to a place where you're sitting down. Get some baby aspirin and give them aspirin. You know, um, we don't want them to swallow it whole. We want them to chew the aspirin because the aspirin is a clot. It breaks up clots.
Mm,
So that's kind
okay.
of what's happening when people have a heart attack. It's a clot that's stopping the blood flow in an artery or, wherever it is close to the heart sometimes, unfortunately. And, but so we want them to relax, get that baby aspirin, get them chewing that aspirin. Now, if this person has a history of heart attack or, stroke, we want to give them the nitroglycerin tablets. And some patients do have those available. What we don't want to do, right? And like you said, calling 911, top of the
Hmm.
list, right? We don't want to ignore the symptoms. We don't want the person to say, "Oh, you know what? I feel calm now. I chewed the baby aspirin. I feel better." Doesn't mean they don't need to go in. They still need to be seen. We don't want them driving themselves to the emergency room.
No, it's not a good idea.
No, not at all. We want them to get somebody whoever they can to drive them. We don't want them to wait it out because sometimes, they'll think, "Oh, I took this, I feel better," or they'll take pain reliever. I'm gonna take some Tylenol along with this aspirin. I'm gonna take an ibuprofen because I think it'll make it better. And we don't want them to do those things. We really want them to seek medical attention, have somebody help them to get the medical attention because we're racing against time. Once we start losing necrotic, when the tissue starts getting necrotic in the heart, that's when we start running into problems. So the
Sure.
heart is so amazing that how a river flows and it'll move all over the place and the streams and everything. Well, the heart is so amazing with the vessels that when one clogs, right? Like we're talking about these silent little symptoms. So we might have some little vessels that are clogging, but the heart is so fantastic, it'll find another way to flow the blood around it. And so sometimes that's what's happening when we're getting those little tiny windows of, hey, something's wrong here, but we ignore it. And sometimes whenever that big time happens where we're having that big heart attack, chest pain, everything, that's whenever it can't ignore it anymore. There's no flow around that area. So
Hmm.
that's where, like I said, we're racing against time. We don't want that heart tissue to become necrotic where we can't use it. So we want to save it. So it's so important for them to get help.
Okay. What should people do if they experience chest pain but are not sure that it's a heart attack?
If they're getting chest pain, if they're in doubt, call their medical office immediately. If they can't get a hold of their medical provider or a nurse, call 911. Even just talking to the operator and telling them this is what's happening, the operator's gonna let them know, "Okay, you know what? This is what we're gonna do from there." And it doesn't hurt, people are so worried about, "I don't wanna bother anybody." We just have
Hmm.
some really
Yep.
great people, right? They're just like, "I don't wanna be bothered." Don't but you know what? They're very important, and it's okay to bother people. That's why we have jobs in the medical field. So, that's why we're here. And so, absolutely, contact 911. And, even if they're like, "You know what? I had these symptoms, I feel better now." Still go into an urgent care because we could still do EKG, test your cardiac enzymes to see if there is an issue with the heart. That's our little window to let us know. Sometimes it's an X-ray because we want to see what's going on with the heart. And from there, go ahead.
Uh, I want to go back to something you said momentarily. It just kind of caught my brain here. Is that you said chew baby aspirin, which is I've heard that in the past. But how many aspirin are we looking at? Just two? Are we to take multiple, three or four,
Yeah,
five?
yeah, they can take up to 4. They can take 4, and that's okay. I have patients that tell me, "I took 5, baby aspirins, I chewed on them," and that's okay. You know what I mean? We'd
Okay.
rather have them do that, than not to, you know what I mean?
Hmm.
And something to happen, because like I said, that's a clot buster. So that's why we have people doing the baby aspirin. It thins the blood.
In the event that maybe they're empty nesters, they don't have baby aspirin, and they probably should have them just in case anyway. Maybe just buy a bottle and have it laying around. But in the event that you don't, would regular aspirin, maybe one or two tablets of regular aspirin, would that work as
Absolutely.
well?
Yeah. Yes, absolutely. You can do that. You could do the baby
Okay.
aspirin or you could do the regular aspirin. Yeah, absolutely.
Okay.
Great questions. I love
Sure.
that.
Um, how about knowing your blood pressure and cholesterol? How is that important in this at all, or is it just something that doesn't really
Absolutely.
matter?
It's so, so, so important. I have a little thing that I show. It's a little prop that I show my patients that whenever people have high cholesterol, like we talked about before, we're looking at that pipe, right? That
Hmm.
pipe that is so full of, gunk, the plumbers know, right? Because they're always going in there.
Yeah.
And that stuff is what breaks off the side. And then it blocks the whole passageway of that vessel. So that's what we're looking at is happening. So whenever that happens, that always happens with high cholesterol because we have too much cholesterol in our blood. And the main, um, culprit of this is the LDL. And that one of all the cholesterol, it's the worst because that one is the one that likes to be the starter of complications and vessels. So we like to get that one under control, and we check that routinely in our patients.
Okay. Now,
So, but the high blood
if
pressure, like you said, leads to it. So they're friends, right? High blood pressure and cholesterol, because
yep.
the amount of pressure that your blood flow is going is what causes those particles to break off. So if you're really angry, and that's what we do whenever people are shoveling snow, they're really moving, their vessels are moving, their blood pressure's
Hmm.
going higher, they're kind of getting a cardiac workout. That's whenever they're putting it themselves at risk because that's when those pieces break off because the blood flow is flowing so fast.
Okay. What
Yeah.
about cardiac rehab after a heart attack? How important is that?
It's very, very important because it matters because what they're doing is they're basically, um, you know, so it's kind of like you got to look at the heart as a muscle, right? So whenever we do cardiac rehab, we're kind of getting that muscle back to where we'd like it to be, right? And so
Hmm.
what we're doing is during that time, we're talking about them about what kind of exercises, what kind of activities are safe for them. These are the activities that are not going to cause your blood flow to go that high. They're not going to cause your blood pressure to go high. And they're educating those patients during that time about eating right, eating healthy, monitoring their blood pressure, monitoring that cholesterol. And it's a really, really good thing for them because we're teaching them, everything and how long does it take, for them to get back to normal, right? That's one of the questions patients want to know immediately, especially after they have a cardiac incident. And it does take, at least, after discharge, about 8 to 12 weeks, right? That's not a long time for their heart to, but
Right.
during that time, this cardiac rehab is so important because we're teaching them the skills how to prevent this from happening again because I'm sure you've heard of the people that say, "Oh, I had 5 heart attacks," I've had, and I've had patients that have had multiple heart attacks and strokes. And so that cardiac rehab is so essential for the education part and to teach them, let's prevent this from coming back.
Okay.
You only get one heart, you know?
That's right. You better use it wisely. Um,
Yes.
how about one thing you want everyone watching to remember about recognizing and responding to a heart attack, Doc?
I want them to think about is heart attacks are not like what they see on TV. They are not that dramatic sometimes. It's
Hmm.
not that, the Samson guy,
Sanford?
"Oh, Elizabeth." Yes,
Yeah,
yes, "Oh,
Sanford.
Elizabeth," you know? Yeah, so it's not like that. It's, sometimes they don't look like that, and they can just be getting symptoms that are not so severe, and they're not really, you know what I mean, concerned about it, but we don't want them to delay because, like I said, you only get one heart. And sometimes when they delay, it can turn out to, be not a good outcome. So we want you to take care of your heart. Like I said, you know, make sure that you're staying healthy and, make sure you're checking your blood pressure and all these other things we've discussed to prevent these things from coming. And if they're smokers, stop smoking this year. Make this year the year, you know?
Make it this year. Doc, real quick before we wrap things up, I don't know what Chicagoland or Chicago area ER rooms look like Saturday night around 10 p.m., but I'll tell you one thing. I had a lot of anxiety, heart attack. It
Yeah,
was on the precipice because those Chicago Bears put me through a lot last Saturday
I
night. They did
know.
it,
I know.
but that
Yeah,
last play, I'm still kind of recovering from
yeah.
it, right?
Absolutely. Absolutely. You're so right on the money. It was like that. And that fourth quarter, I said, you never know. And it's 2 minutes. Come on,
Yep.
they obviously wanted to win it. And it was, it was good for them. So yeah,
Yeah, it was the Cardiac Bears is what I call them. So Cardiac
I know.
Chicago
Yeah.
Bears. That's their
So
name now.
just, yeah, be prepared for the next game with the Rams that we might be,
Yeah,
you know what I mean?
yeah. It's
Hoping not, but you never know.
yeah. Let's jump on top of them first and let's just win a game because we haven't won. It seems like Chicago Bears haven't won a game just like outright. We keep having to come from behind to win these games, and I just want to jump up
Yeah.
on somebody like 28-0 and we can kind of take it easy for the rest of the game.
I do too, I think, we've been saying that, here too. It's like, okay, they're just really making the fans pay this time, so, but, and it was really something because they were saying if you left at halftime, you didn't see the rest of the game because it was just so exciting. And, but it reminds me of the Bad News Bears. And
Mm-hmm.
the
Yeah.
that old movie and stuff like that
Yeah.
where they always are the comeback kids
Yeah.
and I love that about them, and that's why they're my team. Don't count them out. So,
Don't count them out. Go Bears! Sunday night, 5:30
right.
kickoff. Let's go. All right. Well, thanks, Doc. I
Yeah.
sure appreciate it. It's great to see you once again. Happy New Year. Say hi to the family for us.
Yeah. Will do, cuz happy new year to you too.
Talk to you in a couple weeks. All right.
All right. Have a great one.
You too. All right. 5 minutes in front of the top of the hour. We'll take a break. We'll come right back here with more news, and we'll catch up with Western Edge Living at the top of the hour here on KFYR Plus.